Hi, I'm Daniela, and this is Jocelyn. Thanks for coming back to our channel.
In this video, we're going to share what to know about finding the right place to give birth.
More specifically, we're going to look at the differences between at-home birth, a birthing center, and hospital NICU levels.
And why they're important.
Finding the right place to give birth is largely going to depend on your preferences, your location, and your personal pregnancy situation. Originally, we wanted to give birth at a birthing center. I was really gung-ho about it. I even knew about places while we were trying to conceive. And that quickly changed as soon as we found out we were a high-risk pregnancy with triplets.
If you're anything like us, you might be thinking, what's the difference? Why does it matter? And that's exactly what we're going to talk about in this video. So by the end of this video, you'll have a couple options on where you can give birth.
It's great to remember that we are not medical professionals. We're simply going to share with you the things that we have learned along our journey that helped us make our decisions. And also it's great to remember that we're on the East Coast, which may affect some of the options that are available to us and may not or may be available to you somewhere else.
Some of the best resources we found were Mama Natural by Genevieve Howland, When You're Expecting Twins, Triplets, or Quads by Dr. Barbara Luke, and the What to Expect app. I'll leave links to these resources in the description below, but feel free to share any resources you found helpful in the comments.
First, we'll start talking about home birthing options.
A home birth is ideal for those going through uncomplicated pregnancies in optimal health who are really committed to a natural birthing environment. It's also important to live close to a quality hospital in case complications arise.
The great thing about a home birth is that you have the comfort and family-focused intimacy that you really can't get anywhere else. For intentional at-home births, a midwife and/or doula can be present to help assist in all the birthing situations. Overall, the research showed that most home births go really well, and the mothers do great. Only 5% needed to be transported to the hospital for a C-section.
For many pregnant people, an at-home birth may not offer enough support, and that's where a birthing center might be a better option.
A birthing center is what I would consider a happy medium between a home birth and a hospital. This would have been my first choice.
Put in another way, a birthing center is a home-like facility that focuses on low-intervention natural childbirth. So where OBGYNs are usually in charge at a hospital, midwives will be in charge at most birthing centers. The level of care will feel a lot different as well because things like IV fluids, electrofetal monitoring, and epidurals aren't standard at birthing centers.
Something that we learned in the book by Mama Natural is that women who delivered at a birthing center were less likely to tear or have C-sections, and babies were less likely to end up in the NICU.
That's a good point. We actually noticed that the ideal candidate for birthing centers are someone experiencing low risk and uncomplicated pregnancies. If you're someone like us who needs a little bit more medical interventions, then a birthing center won't be the right fit.
Sadly.
From what we've learned, there are both freestanding birthing centers and hospital-affiliated birthing centers. So if you wanted a little bit more security knowing you could quickly be admitted into a hospital, maybe an affiliated birthing center would be the right fit.
Yeah, I think they're usually like connected. So you just like go right over. If you're interested in looking into birthing centers near you, you can visit midwife.org, and they have Find a Midwife tool, which will tell you what birthing centers the midwives are affiliated with.
Now that we took some time to look at birthing options outside of the normal hospital, let's shift gears and look at birthing options in a hospital and the NICU.
NICU stands for Neonatal Intensive Care Unit, which most hospitals have in order to take care of sick and premature babies. We learned that NICUs have levels indicating their capabilities of care. Learning about the different levels can help you decide which one is best for your situation.
The average gestation for a triplet pregnancy is 32 weeks, leaving the average birth weight of a triplet to hover around 3 pounds each. This means that a NICU stay is very likely in our birth plan. If you're curious to learn more about how a triplet pregnancy is different than a singleton, check out the link above. Now let's talk about the different NICU levels.
Level 1 is regular nursery care for babies born 35 weeks or later.
Level 2 is an intensive care unit for sick babies or premature babies between 32 and 34 weeks, weighing around 3.5 to 5.5 pounds.
A Level 3 NICU offers comprehensive care for seriously ill newborns born between 28 and 32 weeks.
A Level 4 NICU includes all the capabilities of a Level 3, except for there are specialty consultants on hand 24 hours a day for babies born 28 weeks or earlier.
Obviously, there are many unpredictable things that can go on during pregnancy, but understanding your situation and the complexities that go with it, as well as the level NICUs available to you and what they cover, can help you make a confident decision.
Once we found out that the average triplet birth happened around 32 weeks, we didn't want to go anywhere else other than a Level 4 NICU. Luckily, we had 2 within an hour radius of us, so we weighed our options and decided which one we liked best.
It doesn't hurt to tour the facilities and meet the doctors that are in the network to decide which is better for you. If this content was helpful for you and your journey, please like and subscribe.
And make sure to turn the notification bell on so you can stay up to date on our next video where we'll talk more about finding the right prenatal care team. See you soon.